these aren't fully formed rings. These are C-shaped rings that help to stent the trachea, keep it open so it doesn't collapse. Okay? So for instance, if I were to take a cross section here through the trachea, I would see a C-shaped ring of cartilage which is open to the back. Okay, this is where the esophagus would be here. So it's C-shaped, it's not an O-shaped ring of cartilage. Okay? Now, sitting between this ring of cartilage and the lumen of the trachea, you're going to have a mucous membrane. Remember, mucous membrane is an epithelial membrane that surrounds an opening that opens to the outside. Okay? Lining the lumen, part of this mucous membrane, is this respiratory epithelium, ciliated pseudostratified columnar epithelium. Okay? It's going to sit on top a layer of connective tissue. Okay? And that layer of connective tissue plus the epithelium is called the respiratory mucosa. Now there'll be another layer of connective tissue deep to that you could call the submucosa. So there's layers, okay? And the submucosa then gives rise to this cartilaginous layer here. Connecting the two ends of the cartilage is a layer of muscle. This is referred to as the trachealis muscle. It gives a little bit. So as food is passing down the esophagus, as that bolus passes through this particular cross section, the trachealis can give. So it's good that you don't have cartilage completely encircling. Now, of course, this cartilage is going to be lined on either side by a layer of perichondrium. Remember, that's kind of a dense connective tissue that forms a sheath on either face. Here. And then connecting the trachea to the esophagus, you can have some loose connective tissue. Some people would call it adventitia. All right. When we move from the trachea into the bronchi, one major difference anatomically is that you transition from rings of cartilage into plates, cartilaginous plates. These are plates. Okay? So once you reach the bronchi, instead of having rings of cartilage, you have smaller plates that encircle the bronchi. So here's your primary bronchi, here's secondary bronchi, here's your tertiary bronchi. They're all surrounded by plates of cartilage, not rings. Okay? All right, this is a section through a trachea. Okay, this is the lumen of the trachea. Here's the epithelium. Pseudostratified columnar epithelium with cilia. Okay. The connective tissue just deep to it is part of the mucosa. So the mucosa is formed of that epithelium plus the underlying connective tissue. If we go a little deeper, we reach the submucosa that in this section demonstrates glands. These lighter staining glands are mucus glands. Okay? So these glands produce mucus that lines the surface of the apical surface. And then if we come down further, deeper, we reach the perichondrium, okay, that's lining the inner face of the hyaline cartilage here. That's kind of the microscopic anatomy of the trachea. This would be a bronchus. It's not uncommon when you look at the mucosa of a bronchus that it looks scalloped, folded, like you see here. Okay? Now, in the bronchi, the epithelium is going to remain pseudostratified columnar epithelium with cilia. Okay? Bronchi demonstrate some smooth muscle. Okay, that's what this is here. Within the mucosa, you see smooth muscle here, here, here. You're going to see glands. These are all glands here. We're seeing the cross section. And then you're going to see plates of cartilage. But you're not going to see a C-shaped ring like we saw with trachea. Now, here's what's going to happen as we transition from bronchi into bronchioles. All right, it's not just a matter of size. As we go from bronchi to bronchioles, the smaller airways, the bronchioles, don't possess any plates of cartilage. Okay, those disappear. Okay, instead, the cartilage is replaced by a greater density of smooth muscle. So the smallest airways are encircled by more smooth muscle. They are more active in bronchoconstriction and bronchodilation. The largest of the bronchioles have a pseudostratified pulmonary epithelium and cilia. But as you move more distally, okay, then the epithelium transitions. Initially into a simple columnar epithelium with cilia. Then into a simple cuboidal epithelium with cilia. And then into a simple cuboidal epithelium without cilia. Okay? In fact, if you look at the respiratory bronchioles here, they have a simple cuboidal epithelium typically. Finally, when you reach the alveoli are lined by a simple squamous epithelium. So the idea is there is a gradual transitioning in terms of the epithelium where it gets progressively thinner and thinner until by the time you reach the alveoli, it's simple squamous. And that allows the gas exchange. So we can see this bronchus. We know it's a bronchus because we see plates of cartilage, and then we see alveoli outside of it. This is a depiction here. Okay? This is showing larger bronchi. These are segmental bronchi. Segmental is another term for tertiary. Okay? And you can see we're going from one generation to the next of bronchi. We know these are bronchi because we see plates of cartilage. Where the cartilage disappears now, we've reached the bronchioles. Okay? Now, the smallest bronchioles that do not participate in gas exchange are called terminal bronchioles. Terminal bronchioles do not have any alveoli butting off their walls. Okay? They will give rise to respiratory bronchioles, as I've depicted here, that do participate in gas exchange. These respiratory bronchioles will then give rise to alveoli and alveolar ducts. The alveoli ducts will deliver the air into alveolar sacs, as we see here. Okay? Now, what we've done is we've taken the terminal part of the airways and we've kind of blown it up, we've magnified it. So this would be a terminal bronchiole here where it's wrapped in smooth muscle, but you don't see any alveoli. Once you see alveoli beginning to bud off, these are respiratory bronchioles. Okay? Now, they're going to lead into alveolar ducts, which you can't see because we're surrounded here by alveolar sacs. Okay? And each one of these is an alveolus. One thing you'll have to differentiate under the microscope is a bronchus from a bronchiole. Here's a bronchiole. The first thing you notice is there is no cartilage within its wall. Only smooth muscle. Okay? Now the epithelium, it's hard to tell. This looks like it could be simple columnar. It may even, it's hard to tell from certain at this magnification. Okay? But these are all bronchioles. Okay? And these would be alveoli. Okay? This would be part of the alveolar wall here. Again, we can see that this would be a terminal bronchiole, this would be a respiratory bronchiole, this would be an alveolar duct, okay? And it's known on either side of alveoli. This is under the microscope. We'll see terminal bronchiole up to this part here. Notice that this is a little bit thicker epithelium. Okay. When we reach the respiratory bronchiole, you start to see alveoli budding off. Okay. These respiratory bronchioles are going to give rise to alveolar ducts, which are lined on either side by alveoli. Okay. And then at the end, you'll see a sac of alveoli. This is a close-up. There are about 3 major cell types that you'll need to identify within the alveolar walls. The type 1 cell is a squamous cell. Okay? Squamous cells simply line the wall, okay, and they serve as a partition between the alveolus and the pulmonary capillary. They're part of what we call the respiratory membrane, and we'll come back to. In addition to the type 1 alveolar cells, though, you do have some cuboidal cells. These are called type 2 alveolar cells. Type 2 alveolar cells produce surfactant. Can we talk about surfactant in AP1?
Not that I remember. Not that I
Okay.
remember.
Surfactant is a material that serves to break up the surface tension of alveolar fluid. Okay? In other words, let's say this is an alveolus here. Okay? That alveolus is going to be lined by alveolar fluid, which is mostly water. But those water molecules are attracted to each other. Okay? Remember, in AP1 we talked about hydrogen bonds. Okay? That creates water tension. That pulls the molecules together. So all of these millions and millions of molecules are attracted to each other, and it creates a tension between water molecules that tends to favor collapse of the alveolus. All of these water molecules, if they had their brothers, they would all come together as a single bead of water. We showed that demonstration in AP1. Remember that? How water beads? And that's the surface tension. Well, these type 2 alveolar cells produce a detergent-like substance called surfactant. And what surfactant does is it interferes with the forces of attraction between water molecules, so that there's less of a tendency for the alveolus to collapse. It's easier to expand the alveolar sacs because there's less water tension favoring their collapse. So surfactant is very important. These type 2 alveolar cells begin to produce surfactant somewhere around 28th week. Okay, where they have enough surfactant where the child's not going to have difficulty expanding their lungs. If a child is born prematurely and doesn't have sufficient surfactant being produced, then they're going to have some respiratory distress. They're going to struggle more to inflate their lungs, to expand their alveoli, because of that surface tension that's created between water molecules and the alveolar fluid. Okay, so that's an important role of these type 2 cells to produce surfactant. What is the condition called where a child's born prematurely, they don't have enough surfactant, so they develop respiratory distress? It's called infant respiratory distress syndrome. many times these preemies end up on a ventilator because otherwise they can't ventilate. Now you see this big old nasty looking cell that's kind of detached away from the epithelium in the center of the alveolus? Here's another one. Those are macrophages. But we call those macrophages that live in the lungs, they have a special name, dust cells. Oftentimes you can see dark particulate matter inside the cytoplasm. Now, if you're a smoker, how many people here smoke? JJ? Smoke? You sure? Okay. If you smoke, you tend to have more of these macrophages, and they begin to fill up with this black soot-like material. Okay? So if you look at the lungs under a microscope of a smoker, you see a lot of these black-looking macrophages. I remember my first exposure. We had it's like a 35-year-old female at Charity Hospital who had a spot on her lungs. In other words, a chest X-ray revealed a nodule, and she was a heavy smoker already. You know, it all starts usually in high school. I think you're familiar with this, in the girls' room. Recess. Between classes. Smoking in the girls' room. Wow. I had to adopt this information. So, in any event, we're going to do an open lung biopsy. Okay, and I'll remember that this was a thoracic surgery. And so, on the outside, this girl appeared quite pleasant. You know, she was nice looking. She was, I wouldn't say beautiful, but she was very pleasant looking. But then when you opened up her chest cavity and looked at her lungs, instead of being a nice pink color on the outside, they were like black as sin. And I thought to myself, wow, there's some ugly lungs. And I didn't realize that was the effect of cigarette smoking. Now, she had in fact, it ended up being a malignancy. But hopefully, I didn't follow it. I could stay in that rotation for a month. But it was removed. In fact, we did a lobectomy. We ended up removing a whole lung because the frozen section showed malignancy. But I remember that seeing her once in follow-up.